Yes, so how many visits should a woman make in the hospital when they are pregnant? I mean antenatal care. What is antenatal care? How many times should you go to the hospital? When should you go to the hospital? All this in this video of antenatal care.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private chat, because some of you really fear to just post your questions on our social media platforms because everyone can read. But if you feel like you want privacy, go to my website and book an appointment. That is www.drothman.com. Book an appointment. I'll be there to answer you. And for those who are free, they can just post on our social media platforms. Just go there, post your question. If I see it, if I get time, I will answer. If I do not answer you in time, please just know that there are several people I am answering, and there is a high volume of questions I sort out. But you can still continue putting your question there, and if you see it's not being answered, then book an appointment. I will be right there to answer you. Now, if you're new on this channel, please don't forget to subscribe and also share our channel. Now, today we are talking about something very good, something that needs everyone to smile. We've all been talking about diseases, but now we are talking about something good, at least. That is antenatal care. So, what is antenatal care? It's the care. Because people just hear antenatal, but it's the care, it's the management, it's that care, it's the services given to a woman after conceiving. So that's why the World Health Organization wants us to call it goal-oriented antenatal care, or what some other people call focused antenatal care. At first, it used to be antenatal care, and it had no serious benefits and so on. Just go to the hospital, come back, just go to the hospital, come back. But it's now called goal-oriented. What we mean by goal-oriented is that every visit has its goal. Antenatal care is very important to a woman who is pregnant. So whoever is pregnant and is watching this video, if you have a friend that is pregnant, please send them this video. Antenatal care is very important. Even when you're planning to get pregnant, there is what we call pre-antenatal visits. Now, with antenatal care, I want to talk about this. Most people think antenatal care is supposed to be done by only the pregnant woman, the woman alone. No, antenatal care should be done by both the man and the woman. This visit to go to the hospital should be done by both of you. That's why in some countries they have put benefits. If it's a couple going for antenatal care, you are served first. And I think I like this. So for those of you who come alone, you're a woman, you're pregnant, you go alone to the hospital, we shall serve you last. Why? Because you didn't get pregnant alone. You were with someone impregnated you. So both of you should go to the hospital. Both of you should listen to the good news and bad news from the doctor. You shouldn't just be asking your wife, what happened? What is this? No, you should go there together. Please, dear husbands, spend time, spare some time. Go with your women, go with your wives, go with your girlfriends to the hospital for antenatal care. This is very important, and I thought I should first talk about this. Men with hospital visits, men with health-seeking behaviors, we are very poor at seeking healthy behavior, at health seeking. So, therefore, now when your woman is pregnant, please make it a date to go with her for antenatal care. This is called focused or goal-oriented antenatal care. Now, there are several questions. What do I benefit from doing antenatal care? Number one, it creates a special strong bond. It creates a special strong bond between the husband and wife. Maybe you guys have never walked together. You find a couple, they have never held each other's hand and then they walk together. A everyone actually, I have seen couples, you find that they are almost working in the same, around the same station. But one wakes up in the morning, drives his car, and then the other one follows. They can't walk together, they can't move in the same vehicle, they can't do anything together. Now, when the woman becomes pregnant, antenatal care should at least bind you, should bond you. You should have that bondage with your partner. So during antenatal care, go there together. That bond will be strengthened. Another issue is that it creates a bond between the woman and the baby, and further creates the bond amongst the woman, the baby, and the father. This is very important, and this is one of the main importances of antenatal care. Then another one is that antenatal care will allow a woman to get screened in order to have fetal maternal well-being. So we shall have fetal maternal assessments during antenatal care, and therefore goal-oriented antenatal care is one of the strives health workers are making in order to prevent maternal and child death. Then antenatal care prevents complications during pregnancy, because these complications, the risks may be detected during those visits, and thus decreasing or reducing on mortality of the mother and the child. It shouldn't surprise you that antenatal care also prevents unwanted pregnancies, because during one of the visits we discuss about family planning. We look at, now you are pregnant, you are going to deliver in 2 weeks or in 3 weeks. What is your plan? When do you want to have another child? And we do plan about that to prevent unwanted pregnancies. Then, during antenatal care, because we provide counseling services to the woman, antenatal care prevents post-delivery complications, psychiatric conditions like maternal blues. Actually, you've seen several times people giving you stories that a woman ate her own baby after birth. These stories are true. People telling you that a woman refused to breastfeed her baby after birth. People telling you that the woman became violent. The woman is beating her own baby, a newborn, 1 day, 2 days. The woman doesn't want to breastfeed and so on. That is a psychiatric condition. And this should have been dealt with during the antenatal visits. Now, when we talk about this antenatal care, how many times is a woman supposed, or is the couple supposed to go for antenatal care? How many visits? We advise that they should be at least 4 visits. At least 4 visits. And when are you supposed to start antenatal care? As early as you detect that I am pregnant. Some people think you're supposed to go there at 3 months, at 4 months. Here we test women. A woman is pregnant, you confirm pregnancy, and you ask them to start antenatal care, and they're like, no, doctor, it has not yet reached 3 months. It has not yet reached 6 months. I can't do antenatal care. No, you are lying. Antenatal care is begun, is started, is initiated as early as you confirm that you are pregnant. Antenatal care calls you now. So, what is done in these visits? I'm going to talk about the 4 visits. Actually, visits can be many. They can even be 10, depending on every woman. Every woman has their different issues. But at least they should be 4. And they should be done as early as you detect that you are pregnant. Now, what is done in the first visit? Visit number 1. In the first visit, we do what they call identification. We take your history. We get to know you. Who are you? We get to know you externally and internally. This is the point where we issue an antenatal card, what people call the mother's passport. Why do we issue the mother's passport? Imagine there are some women, a woman is pregnant, but the baby is small, is not having a big abdomen. It is not showing. And then he's been driving all day, is involved in an accident, and then is taken to the hospital. If this woman is not having an antenatal care in her bag or somewhere, we can't even give you medicines that are not supposed to be given in the pregnancy. But when we check your bag, or if you have your antenatal book, you walk with it, you have your antenatal book there. When they check you, hey, she's pregnant, therefore don't give this, don't give this. This antenatal book also keeps the records. Today you're with me, I'm managing you, but the following day you're going to another doctor, you're going to another hospital. They should know what I did. And these records are all kept in the antenatal book or the mother's passport. Now, what is done in that first visit? Issuance of the card. Identifying you, your age, how many pregnancies have you had so far? Have you had any miscarriage? Any history of this? This is how we can prevent some of the diseases. Because during this visit, we are going to find out, do you have a relative who has preeclampsia? Do you have a relative with this? Do you have a relative with this? So if we know that you have somebody with this, therefore, we shall know what to do. We shall do some blood checkups. We do blood checkup. You do blood sugars. We check any abnormality you may be having. And that is what we call risk assessment. Maternal assessment, maternal well-being assessment. We are assessing how fit are you to deliver. And all this is done during the first antenatal visit. The first antenatal visit, we have to do all that. We have to do preventive measures. We give you tetanus. We deworm you. We prevent anemia by giving you iron. We prevent diseases like spina bifida. Spina bifida is a disease that affects babies, whereby you find that the baby is having a hole at the back, and some of the contents of the spine, all of the vertebra are passing out, are passing through that hole. These children cannot grow very well. They have a problem with the spine. They cannot sit properly. They will have motor issues, a lot of problems there, mental issues. So that's why during the visit we give you the folic acid. We give you the folic acid to prevent that. Because studies have shown that most babies who have spina bifida, their mothers did not take folic acid. So we give you that. Those are preventive measures. All those are done in the first visit. We do screening of diseases. We check for HIV. We check for syphilis. Any other STI, sexually transmitted infection, we check for them so that they can be treated. Because some of them can be transmitted to the baby or to the fetus if not treated. We also assess for domestic violence. For example, a woman has come alone. We need to find out why the husband didn't come. And through that story, the interaction, you may find that there is something wrong in the family. And probably we can do something about it. We can have a counselor. So, domestic violence. And domestic violence is very, very serious. And it can be life-threatening when a woman is pregnant. In this visit, we also do assessment of the fetal well-being. That is when we do an ultrasound scan. Let me tell you, an early ultrasound scan, a scan done early in the fetal being, when the fetus is still young, when the child is still young, will enable you to detect congenital abnormalities. Let me tell you, there are congenital abnormalities that are not compatible with life. Your baby gets an abnormality and the baby cannot survive on earth. So why should we allow you to give birth to a baby who is abnormal, who cannot survive, who is not compatible with life? Therefore, when we detect a congenital abnormality, there are many congenital abnormalities, we inform you and you make a decision. So all this is done during the antenatal visit, especially the first antenatal visit. Now, in the second antenatal visit, mainly we focus on the maternal and fetal well-being. We do an assessment. Actually, what I forgot in the first visit, we have to calculate the expected date of delivery and the weeks of amenorrhea. We must know how the size of your baby. When are you expected to deliver? And we inform you that your EDD is calculated, that is the expected date of delivery. You will be able to deliver on 22nd of March 2022. Sometimes we are accurate, but other times we have it is plus or minus 2 weeks. So you may deliver before, on that we may deliver 2 weeks before the date or 2 weeks after the date. But at least we shall give you an estimate of the date you'll have to deliver. So don't take EDD as a gospel truth that they told me I'm supposed to deliver on the 21st. If I don't deliver on the 21st, it means that no. It's a range of 2 weeks, plus or minus 2 weeks. So in the second visit, we said that we assess the maternal well-being. We palpate. How is the baby? What is the position of the baby? Is the baby fine? That is fetal well-being. How is the mother? Is there swelling? Do you have headache? What is the problem? Maternal well-being. And if we discover any problem, you get treated immediately. Now, again in this second visit, we do birth and emergency plans. We plan for your delivery. One, where are you going to deliver from? After delivery, where will you go? So we plan around that. And the emergency plan, because we know that you may have an emergency during pregnancy. Who is your contact? Who will pick you? Do you have an Uber around? Do you have any person, any motorcycle around? A friend who can pick you in case you cannot drive, in case who is going to help you in case of an emergency? Which hospital can you go first? All that discussion should be done during the second visit. We also, of course, during the second visit, we also do the preventive measures, giving deworming tablets, continuing with iron, and issuing a mosquito net. For those women that do not sleep under mosquito net, then we give advice on nutrition. So we are supposed to educate this woman how she's supposed to eat, what are you supposed to eat, what you should avoid, and so on. So all that is done during the second visit. In the third visit, the third visit is almost the same as the second visit. So what we did in the third visit in the second visit is the same thing that is done in the third visit. And also assess, is there any problem with the woman, and deal with it. Now, what is done in the fourth visit? Of course, the fourth visit is also similar to the second visit. So you realize that antenatal care is very, very important in the first and the second visit. Now, in the fourth visit, we emphasize the birth or delivery plans and emergency plans. We emphasize the danger signs. Now, this is the time we are going to tell you, when you see this, do this. This is the time you will have the other plan of evacuation, how will you go to the hospital, and so on. The contact persons, the contacts of your midwife, of your doctor should be given to you. The contact of any transport person who can help you in case of an emergency plan. In case of an emergency. And I think you are seeing the reasons as to why we do these visits, because they are very, very important for maternal and fetal well-being. If it's your very first time to come to this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important video we upload. If you'd like to get in touch with me, go to my website www.druthman.com. Book an appointment. I'll be there to chat with you. We are available on all social media platforms. The name is Ask Dr. Uthman.
Ask Dr. Uthman on Masawa Wall.